we'd like to show you what we're doing in Perth, the capital of Western Australia, to bring healthcare to our homeless population. It's based around a unique homeless medicine practice which sees homeless patients wherever they are in their journey. We start at Perth's only inner-city hospital, the Royal Perth Hospital, where the homeless team is at work on the wards. Dr. Andrew Davies, GP and founder of the Homeless Healthcare GP practice, is there with practice nurse Sarah and the homeless team's Royal Perth staff, our admin assistant Misty, community caseworker Jace and RPH consultant Dr. Amanda Stafford. The GP database is in a laptop which holds consultations from all 12 homeless healthcare clinic locations. The GP, nurse and caseworker gather at the bedside, bringing their homelessness and healthcare expertise. They see the most elusive homeless individuals, disconnected from all services, and the recently homeless who don't know where to turn for help. This diagram shows all the homeless healthcare GP clinic locations and how many patients are seen where. It's the homeless team at Royal Perth Hospital, the after-hours support service visiting the recently housed, a standard GP clinic at Transitions, clinics at supported transitional accommodation facility St Bart's and Beacon, drop-in clinics at 3 homeless drop-in centres, Shopfront, Tranby and Rua, a clinic at drug and alcohol rehab Harry Hunters, at Harmony, a domestic violence shelters, and at Street Health, where the most marginalised homeless people can be found. This network of homeless medicine clinics serve our homeless population throughout their journey from homeless to housed. Let's visit some of these places. The Beacon is a transitional accommodation facility for men and women, providing 3 to 6 months of accommodation and support to set them up for a return to more mainstream life in longer-term accommodation. The homeless healthcare team work with Beacon staff and open up a GP clinic within the Beacon facility in a set of multi-purpose offices twice a week. They bring their materials and equipment with them so they can provide GP services their patients require. This young woman has come today for hepatitis C testing. She needs that to start curative treatment. Her IV drug use means her veins are hard to access, so she gives the staff a hand to get the blood needed. The Hep C medication will be prescribed and supervised entirely by the GP practice, and she'll complete her 3 months of treatment at the Beacon as part of creating a clean life off the streets. The homeless health van pulls up outside the Tranby drop-in centre twice a week at 7 a.m, bringing a clinic to the rough sleepers who come here in the morning for breakfast, showers, catching up with the caseworkers and seeing other specialised services like legal and welfare payment assistance. The homeless healthcare staff bring in their equipment to set up a clinic in the offices, with a nurse practitioner and a clinical nurse who goes out to rustle up business for the clinic among the crowd, with the help of the drop-in centre staff who know which clients need to be seen that day. A simple dressing means the difference between healing a wound and a chronic sore, between health and sickness. It also builds the relationship for further healthcare and chronic disease management as the person's social situation improves and their health becomes a priority. Aboriginal people are overrepresented tenfold in our homeless population. Both the local Noongar people and those from rural and remote communities who come down to Perth either for hospital treatment or to visit family. Passages is a drop-in centre for homeless youth in which a weekly GP clinic brings its young clientele into contact with health services, often for the first time. It's an important time of life to intervene before a lifetime of social marginalisation sets in. The clinic sets up from the homeless healthcare van in an office in the youth drop-in centre, with 2 clinical nurses, a nursing student and a GP. Homeless healthcare nurse Jen and nursing student Angie see a young transgender woman about her painful hand. Again, a simple healthcare consultation can be the conduit to addressing the deep, painful issues which underlie most youth homelessness. It's another sunny day in Perth, and the homeless healthcare van has set up next to a food van in a local park, the breakfast stop for some of Perth's most marginalised rough sleepers. And the best medicine is sometimes just footwear to protect feet from blistering pavements and broken glass. These hidden homeless live in the shadow of Perth's central city, in its parks and on the pavements. The beautiful setting on the banks of the Swan River hides an unpalatable reality. Although Western Australia has a strong economy, there is still great inequality, which traps people on the street, especially those with mental illness, substance abuse, and traumatic lives. The street health clinics may be the first contact with homelessness health services, an opportunity to build trust and deliver basic health care like dressings, suturing and antibiotics. But as street health works the local parks, they also find rough sleepers who have become seriously unwell and need to be hospitalised at nearby Royal Perth Hospital. Behind the scenes is a collaboration of all Perth's major homelessness services working together towards eradicating homelessness. At this recent workshop to build a shared real-time list of all Perth's rough sleepers, around 20 agencies, including Royal Perth, come together in a common purpose. They map the rough sleeping hotspots and each agency's cover of street outreach, working together to spread coverage, reduce overlaps, and put all their clients on a common database. It's a willingness to put aside organisational issues to reach a shared goal of eradicating rough sleeping. We're back at Royal Perth Hospital, joining the homeless team on their rounds again. The team gathers around a patient, listening, asking, explaining, offering options, offering understanding, offering hope, helping to start a journey back from the margins with support every step of the way.